Your doctor may have handed you a prescription and said only one sentence, take 1 tablet daily. And because you are responsible, you did exactly that. Every morning, maybe right beside your coffee cup, maybe after brushing your teeth, maybe with breakfast. You did not miss it on purpose, you did not ignore your doctor, you followed the label. But here is the part many people over 60 are never taught clearly enough. With blood pressure medication, the dose matters, the medication matters, and the timing can matter too. Not because you should suddenly change everything tonight. Please do not do that. Never change the time, dose, or schedule of a blood pressure medication without speaking with your doctor or pharmacist first. But if you understand the timing mistakes I am about to explain, you may discover why your blood pressure looks fine in the clinic, yet still rises at home, why you feel dizzy after breakfast, why you wake up to urinate 3 times at night, or why one missed pill can lead to a frightening moment. This is Health 360 Days, and today we are talking about 5 blood pressure medication timing mistakes that can quietly affect your heart, your brain, your sleep, and your safety after 60. Before we begin, do one thing for me. Write your age in the comments and tell me, do you take your blood pressure medicine in the morning, at night, or at a different time? And were you ever clearly told why? Your answer may help another viewer realize they need to ask their doctor the same question. Now let's start with the big idea. Blood pressure is not the same number all day long. Your body runs on a 24-hour biological clock called the circadian rhythm. At night, in many healthy people, blood pressure naturally dips while the body rests. In the early morning, often between about 4 a.m. and 10 a.m., blood pressure tends to rise as your body wakes up, stress hormones increase, and the nervous system prepares you to stand, move, think, and work. This morning rise is normal. But after 60, it can become more stressful on the body because arteries often become stiffer with age. When arteries are less flexible, a sudden rise in pressure can hit the blood vessels harder. That is one reason many heart attacks and strokes happen in the early morning hours. So the question becomes, is your medication protecting you at the time you need it most? For some people, the answer is yes. For others, especially those whose blood pressure does not dip properly at night, the answer may be no. And the only way to know for sure is not guessing. It is proper monitoring, especially home blood pressure readings or a 24-hour ambulatory blood pressure monitor ordered by your physician. That leads to mistake number 5. Assuming once daily automatically means first thing in the morning. For decades, many people were told to take blood pressure medication in the morning simply because it was easy to remember. And for many patients, that is still the right choice. The most important rule is consistency. A medicine taken every day at a safe, consistent time is far better than a perfect schedule you forget 3 times a week. But some studies have suggested that evening or bedtime dosing may improve nighttime blood pressure control for certain patients. Other large studies have found that bedtime dosing does not clearly reduce heart attacks and strokes for everyone. In plain English, the science is not saying everyone should switch to nighttime. The science is saying the best time may depend on the person, the medication, the blood pressure pattern, and the risk of side effects. That is why the smartest question is not, should I copy what someone on YouTube does? The smartest question is, doctor, based on my medication and my blood pressure pattern, should I take this in the morning, evening, or at bedtime? Let me give you a real lifestyle example. Imagine a 72-year-old woman named Eleanor. She takes her medication every morning at 8 a.m. Her office readings look acceptable. Her doctor is satisfied. But at home, she often wakes with headaches and her morning readings are higher than expected. Her physician orders a 24-hour monitor. The report shows that her blood pressure climbs sharply before sunrise, long before her morning pill has reached its full effect. Now, the solution is not for Eleanor to move the pill on her own. The solution is a conversation. Her doctor reviews the medication type, her kidney function, her fall risk, her nighttime blood pressure, and her daily routine. Then the doctor may decide to adjust timing safely. That is the message. Not fear, not guessing, but personalized timing. If you find this kind of practical medical education helpful, subscribe to Health 360 Days, follow the channel, and share this video with someone who takes blood pressure medication. Many people are taking the right pill but never had the right conversation. Now let's move to mistake number 4, because this one hides in one of the most American morning habits of all: coffee. Mistake number 4 is taking certain heart medications and drinking coffee at almost the same moment, especially if you are sensitive to caffeine. Now, I want to be clear, coffee is not poison. Many people can drink coffee safely. Some studies even connect moderate coffee intake with health benefits. But caffeine is still a stimulant, and if you are taking medication that slows the heart or lowers blood pressure, timing can make a difference in how you feel. This matters most for people taking beta blockers, such as metoprolol, atenolol, carvedilol, bisoprolol, or similar medications. Beta blockers work by reducing the effect of stress signals on the heart. Think of your sympathetic nervous system like a gas pedal. It tells the heart to beat faster and harder. A beta blocker gently takes some pressure off that pedal. Caffeine can do the opposite. It can temporarily increase alertness, stimulate the nervous system, and in some people raise heart rate or trigger palpitations. So when a person takes a beta blocker with a strong cup of coffee, then feels a flutter in the chest 30 to 60 minutes later, the problem may not be anxiety at all. It may be a timing issue, a caffeine sensitivity issue, or a medication response that deserves attention. Picture this. A retired teacher named Margaret is 68. Every morning she wakes at 7 o'clock, pours coffee at 7:15, and takes her metoprolol at 7:20. By 8:30, she feels a strange flutter in her chest. She thinks, maybe I am just stressed. But this happens almost every morning. When her clinician reviews the routine, they do not immediately add another medication. They first ask a simple question: what do you drink with your pill? That one question matters. A safer habit for many people is to take the medication with water, then wait before drinking coffee. For some, 30 to 60 minutes may be enough. For others with rhythm problems, anxiety, tremors, or caffeine sensitivity, the doctor may recommend less caffeine, decaf, or a different schedule. And here is the simple Health 360 Days rule. Do not use coffee as your pill water. Use water. Make the medication moment clean and consistent. Coffee can come later if your doctor says it is safe for you. This is also where viewers over 60 need to pay attention to symptoms. If you feel chest pain, severe shortness of breath, fainting, or a new irregular heartbeat, that is not a wait-and-see moment. Seek medical help. But if you simply notice mild palpitations after coffee, write down the time of your pill, the time of your coffee, and the time symptoms begin. Bring that pattern to your clinician. That pattern may be more useful than one random blood pressure number. Before we go to mistake number 3, please comment below. Do you take your pills with coffee, tea, juice, or water? Be honest. This is not about shame. This is about helping each other notice routines we never questioned. And if this video is useful, like it, subscribe, and share it with a parent, spouse, or friend who starts every day with coffee and medication on the same table. Mistake number 3 is one of the most important food and medication interactions in blood pressure care: grapefruit. Many people have heard grapefruit can interact with medicine, but they do not understand how serious that can be. The danger is not only the grapefruit you drink at the exact same time as the pill. For some medications, grapefruit can affect drug processing enzymes in the intestine for much longer than one breakfast. Grapefruit and grapefruit juice contain natural compounds that can interfere with an enzyme called CYP3A4. You can think of CYP3A4 as a processing gate in the gut. It helps control how much of certain medications enters the bloodstream. When grapefruit blocks that gate, more of the medication may enter the blood than intended. For some calcium channel blockers such as felodipine and nifedipine, grapefruit can increase drug levels and raise the risk of side effects such as dizziness, flushing, swelling, or blood pressure dropping too low. Amlodipine is often less effective than some others, but you should not guess. The exact answer depends on the exact drug. This is where a 30-second pharmacist conversation can prevent a dangerous day. Imagine Robert, 72, who has taken his calcium channel blocker for years without trouble. His wife buys a healthy citrus blend juice. The label looks harmless. He drinks it for breakfast. A few days later, he stands from the table, gets dizzy, and nearly falls. He did not change his prescription. He changed the juice. That is how these problems happen. Not because people are careless, but because nobody taught them where to look. Here is the action step. If you take a calcium channel blocker or any long-term heart medication, ask your pharmacist, does grapefruit interact with this exact medication? Not, is grapefruit healthy? Not, is fruit okay? Ask about the exact drug name. If the answer is yes, avoid grapefruit and grapefruit juice unless your clinician specifically says otherwise. Choose water, orange juice, apple juice, or another option your care team approves. And always read labels on mixed juices because grapefruit can hide inside citrus blend or ruby red products. Mistake number 2 is taking a diuretic too late in the day. Diuretics are often called water pills. Common examples include hydrochlorothiazide, chlorthalidone, and furosemide. They help the body remove extra salt and fluid through the kidneys. Less extra fluid in the bloodstream can mean less pressure inside the blood vessels. That sounds simple, but timing can change the entire experience. If you take a diuretic late in the afternoon or evening, the medication may push your kidneys to make more urine at night. Then you wake at 1 a.m., 2 a.m., or 3 a.m. You sit up quickly. The room is dark. Your blood pressure shifts as you stand. You walk toward the bathroom half awake. That is when a small medication timing mistake can become a fall, a fracture, or an emergency. For adults over 70, nighttime falls are not a small inconvenience. A hip fracture can change independence, mobility, and quality of life in a single moment. That is why diuretic timing deserves respect. Now, not every diuretic schedule is the same. Some people with heart failure or fluid overload may have a special plan from their doctor. Some take more than one dose. Some need timing based on swelling, breathing, kidney function, or daily weight. But for many people, diuretics are usually taken in the morning. If a second dose is prescribed, it is often scheduled earlier in the afternoon rather than close to bedtime. The practical rule is this: do not move a diuretic to dinner time simply because you forgot it earlier. Ask your doctor or pharmacist what to do if you miss a dose. And if your bottle only says once daily, ask, what time of day is safest for me? Let's look at Patricia, age 74. She has taken hydrochlorothiazide for more than a year. Nobody explained timing. She takes it with dinner because that is when all her pills are on the table. She wakes 3 times every night to urinate. She thinks it is just aging. But after her clinician moves the medication to the morning, her sleep improves. She is not cured of aging. She is simply no longer making her kidneys work overtime at 2 a.m. Sometimes the solution is not stronger medicine, sometimes it is smarter timing. Here is your home safety checklist if you take a diuretic. First, ask what time you should take it. Second, ask what to do if you forget it. Third, keep a nightlight on the path to the bathroom. Fourth, stand slowly from bed. Sit at the edge of the mattress for a few seconds before walking. Fifth, tell your doctor if you are dizzy when standing, because that may be orthostatic hypotension, a drop in blood pressure with position change. And one more important point: some diuretics can affect potassium, sodium, and kidney function. Do not start potassium supplements on your own. A banana or potassium-rich food may be fine for many people, but potassium can be dangerous in the wrong medical situation, especially for people with kidney disease or those taking ACE inhibitors, ARBs, or potassium-sparing diuretics. Ask before supplementing. This is why Health 360 Days always comes back to the same idea: simple habits, medical guidance, and no guessing. If you are learning something useful, take 1 second to subscribe and follow Health 360 Days. It helps the channel reach more seniors and families who need clear, practical health education. And please share this video with someone who wakes up at night to use the bathroom. It may start an important conversation. Now, mistake number 1 may be the most common and the most dangerous: missing a dose, then doubling up later. Almost every patient has done something like this. You are busy, you leave early, you forget the morning pill. At lunch, you are not sure if you took it. By evening, you see the pill still in the organizer and think, I'll just take 2 tonight and catch up. Please hear me carefully. Do not double blood pressure medication unless your doctor or pharmacist specifically tells you to. For many blood pressure medicines, taking 2 doses too close together can drop blood pressure too low. That can cause dizziness, weakness, fainting, falls, or in people with heart disease, not enough blood flow to critical organs. And if you are older, dehydrated, taking multiple medications, or drinking alcohol, the risk can rise. The general advice for many medications is, take the missed dose when you remember, unless it is close to the next scheduled dose. If it is close, skip the missed dose and return to the normal schedule. But the exact rule can differ by medication, so your safest move is to ask your pharmacist for written instructions for each prescription. Let's make this practical. Take your medication list and write next to each drug. If missed, what should I do? Do not wait until you are confused at 10 p.m. Ask in advance. A pharmacist can often answer this quickly, and that answer can prevent a dangerous double dose. Now imagine Dennis, age 66. He works irregular hours. Some mornings he leaves the house before breakfast. Sometimes he forgets his blood pressure medicine. At night he tries to fix it by taking the missed pill with the next pill. One evening he stands in the kitchen, becomes lightheaded, and wakes up on the floor. His blood pressure is very low, there is no stroke, no heart attack, just a preventable medication mistake. That story matters because many people think the danger of blood pressure medicine is only high blood pressure, but too much medication at once can create the opposite problem. Pressure too low for safety. Here are safer strategies. Use a weekly pill organizer. Set a phone alarm with the medication name, not just pills. Connect the dose to a daily anchor, such as brushing your teeth or your first meal. Keep a written medication schedule on the refrigerator. If you live with someone, ask them to help you check the organizer, not nag you, just check. And if you are not sure whether you already took a pill, do not guess. Look at the organizer. Check your log. Call the pharmacy if needed. Guessing is how double dosing happens. This brings us back to the 5 timing mistakes. Number 5, assuming every blood pressure pill must be taken in the morning. Number 4, washing medication down with coffee when caffeine may be working against your body. Number 3, ignoring grapefruit interactions with certain medications. Number 2, taking diuretics too late and increasing nighttime bathroom trips and fall risk. Number 1, missing a dose and doubling up without professional guidance. Now I want to add the most important clinical point in this entire video. The goal is not to make you afraid of medication. Blood pressure medication saves lives. It reduces the risk of stroke, heart attack, heart failure, kidney damage, and vascular disease. If you have been prescribed medication, it is not a sign that you failed. It means you are using a tool that modern medicine has developed to protect your future. But every tool works best when it is used correctly. A seatbelt saves lives, but it must be worn the right way. A cane prevents falls, but it must be the right height. A blood pressure medication protects the arteries, but it must be taken consistently, at a safe time, and without avoidable interactions. So here is what I want you to do before your next doctor visit. Question 1. What is the best time of day for me to take each blood pressure medication? Question 2. Should any of my medications be taken at night or should they stay in the morning? Question 3. Would home readings or a 24-hour blood pressure monitor help us understand my pattern? Question 4. Do any foods, juices, supplements, or coffee interfere with my medications? Question 5. If I miss a dose, exactly what should I do? Write those questions down. Take them to your appointment and bring your real medication bottles, not just a memory of the names. Many mistakes happen because people say, I take the little white one, and nobody knows which little white one that is. Also bring your blood pressure log. Measure at home the way your clinician recommends. Sit quietly, support your feet, rest your arm, use the right cuff size. Do not take a reading immediately after rushing, arguing, exercising, smoking, or drinking coffee. One careful log can teach more than one rushed office reading. If your blood pressure is very high, such as around 180 over 120 or higher, or if you have chest pain, severe headache, weakness on one side, trouble speaking, vision changes, severe shortness of breath, or fainting, seek emergency care. Do not try to solve emergency symptoms with YouTube advice. For everyone else, use this video as a conversation starter, not a prescription, not a replacement for your doctor, a conversation starter. Now let's close with the mindset I want every adult over 60 to carry. Your body is not a machine that failed. It is a living system that changes with time. Arteries stiffen, sleep changes, kidney function can shift, digestion slows, balance becomes more delicate, and medications that worked smoothly at 55 may need closer attention at 70 or 80. That does not mean you are helpless. It means you need better information. Sometimes better health does not begin with a new drug, it begins with one better question. Should I take this with water? Does this interact with grapefruit? Is my diuretic too late? What happens if I miss a dose? Should we check my blood pressure during sleep? These questions are simple, but they are powerful. And please remember this: never stop blood pressure medications suddenly unless your doctor tells you to. Some medicines can cause rebound problems if stopped abruptly. If you are dizzy, tired, swollen, coughing, urinating all night, or worried about side effects, call your clinician. Do not silently quit. There is almost always a safer adjustment than stopping on your own. Here at Health 360 Days, our mission is to make medical information understandable, practical, and respectful for adults who want to stay strong, independent, and informed. You deserve more than rushed instructions. You deserve to understand why you take what you take. So tell me in the comments, which mistake surprised you the most? Coffee, grapefruit, diuretics at night, doubling up, or the question of morning versus bedtime dosing? And tell me your age and your routine, morning dose, evening dose, or bedtime dose. Your comment may help another viewer feel less alone and more prepared for their next appointment. If this video gave you value, subscribe to Health 360 Days, follow the channel, click the like button, and share it with someone over 60 who takes blood pressure medication. A simple share could help someone avoid dizziness, a fall, or a dangerous medication mistake. Thank you for watching. Take your medicine seriously, take your questions seriously, and never be embarrassed to ask your doctor or pharmacist for clearer instructions. Your heart, your brain, and your future independence are worth that conversation.